let's talk about self-care for a minute. And I want to just define a little bit of the difference between self-care and self-compassion, because those are two words that we both are familiar with. But, for anyone listening who isn't, self-compassion is this idea that we can be really kind and treat ourselves like we would a best friend, and just being very like forgiving of ourselves. But then self-care is taking that into action and doing things that are, the purpose is to take care of yourself. So with that in mind, Sarah, what are you doing for 2021 to integrate more self-care into your daily practices?
So I'm putting hard boundaries on work. So I have a company of my own. So I'm a little like business owner on the side, nursepreneur, but I'm trying, when you have your own business, you can set your own hours, but a lot of times I'm willing to work really late or get up early or let it like blend into my personal time. And I'm trying to set really hard limits on boundaries with time. So I'm trying to like cut off before dinner, have dinner with my husband, not get back online in the evening. I'm also trying to do less social media time, which some days I'm really good at and some days I fail at, but that's okay. That's also keeping connected with my friends, which is part of my self-care, right?
Absolutely.
I'm also very intentionally trying to work. I work in emergency department and also my radiology unit. So I try very intentionally to pick up more radiology shifts and less emergency department shifts right now, just because I have that luxury. The EED is just really, really stressful right now with the surge going on and all the COVID patients that we're seeing. And I have the ability to work also and serve my community in radiology. So I'm just choosing that because that's a better fit for me right now. And then I'm also having the goal of doing more yoga, but in operationalization of that, I haven't maybe done it as much as I should, but I think about it a lot. So I think that's helping with my centering and Zen, but I'm hoping to see more of the yoga lady I follow online in the near future. And hydrating a lot and trying to eat a little bit better. But again, all of those things are goals and not always things that happen. But I think also just trying to be very gentle with myself and knowing that if I hit it 3 out of 5 times, like that's awesome. If I hit 1 out of 5 another day, it's okay.
Totally.
But just trying every day to start again, to see how that goes, and then trying to hit my self-care goals as much as I can. What about you? What are you doing for yourself in 2021?
I am similar to you. I think 2020 just was a moment for all of us to just sort of come back to reality, in the sense that, like, what are your priorities in your life? What is most important to you and your family and your bubble? So I don't know, like 2021, I'm just trying to keep things simple. I know, like we talked about earlier, I'm, working, I'm also in school. I also have things on the side that I like to do, hobbies and, interacting with people online. And, with all of that, I just have to make sure that I'm setting boundaries as well. I'm trying to say no to things. I've already said no to one thing in 2021 that I was, just thinking like, this is just going to add extra stress to my life. This is something that's not a priority. I am just not even going to go there, where naturally, like, my instinct is to say yes to all the things and opportunities. But trying to say no a little bit more is one of my self-care strategies. Other ones for 2021 really is just kind of, focusing on doing something for myself every day. So what I define as self-care is anything that's going to promote my mental or physical well-being. So anything that can positively impact that, that's something that I quote unquote call self-care. It could be anything from, like you said, being hydrated, doing something like yoga or something physical activity, getting sleep at night, just, making dinner with my husband in the evening. All of those are little self-care activities, and I try and scatter those through my day as much as possible. And those have become my priorities, because I know that that's how I'm living, and recharging and refilling my my bank account or my bucket or my cup, whatever analogy you want to use. That's how I can recharge myself so that I can give back to my patients.
Absolutely. Because if you're not taking care of yourself, how can you take care of others? My favorite refrain, I feel like, of our common love of self-care for nurses. It's like, if you're not well as a nurse, how are you going to make other people well at work?